Good evening, everyone. I am Richa Sera, founder and editor-in-chief Responsible Hospitals, and today I would like to welcome all of you on our Insta Live sessions. As usual, I have always come up with a different kind of topic, and today's topic is all about fibroids. As you have been noticing that fibroid is something which has come up in the people's eye nowadays, and nobody knows it actually what are the causes and symptoms and how can we cure it. So we'll be talking about it shortly with Dr. Sunaina Bansal with us. She's from Chandigarh Cloud9 branch and she'll be with us talking about fibroids in deep. So we'll be joining the session soon and we'll be starting it ASAP. So in case any of you who has been going through with the same kind of problem and knows anyone who is into it, please come up with the question and we will be answering it right now. So I'll be just adding her right away. Just give me a moment. Dr. Sunaina, can you just hear me? If yes, then just let me know. I just sent you. Please join the session so that we can just start it right away. Good evening, Dr. Sunaina. How are you doing?
Good evening. I'm absolutely fine. How are you?
Thank you so much. And it's our pleasure to be with you right here on this channel. So Dr. Sunaina, today's topic is about fibroids. And we'll just try to talk about that. What is uterine fibroids? We can just start right from here.
So, fibroid, as we can make out from the name, fibroid is a tumor which is made up of fibrous tissue or muscular tissue of the uterus. So, the wall of the uterus has a lot of fibromuscular tissue, and any swelling arising out of that fibromuscular tissue is called as a fibromyoma. Myoma means a muscular tumor. So, fibromyoma or a myoma. So, it is known as a fibroid.
Okay. So, well, what do you think when a pregnant lady who is just trying to conceive, or let's say a person, let's talk about person who has conceived already, and they got to know that they have got fibroids. So, is there something which they really need to be serious about this issue? I mean, what do you think? How do they react to it? Because a lot of people get confused at that situation, whether they should continue with the pregnancy or they should not continue. So, how does it depends on it?
Okay, so fibroids are very, very common in the reproductive age group. In fact, we say that the incidence of fibroids is about 30%. So every third lady, literally every third lady would be having a fibroid. So many a times when the fibroids are small, they do not give any symptoms at all. So nobody goes for an incidental ultrasound also. So many a times it happens that a fibroid is first detected during a pregnancy ultrasound. And obviously that's a matter of concern because everybody gets a little anxious what to do now. But usually the fibroids that are smaller in size and that have not given any symptoms earlier will not usually create any problem during the pregnancy also, especially if their location is such that they are not interfering with the growth of the pregnancy.
Okay.
There are three kinds of fibroids. One of the fibroids will project into the cavity of the uterus where the pregnancy is growing.
Right.
Such kind of fibroids can create a problem with the growth of the baby. There is a second group of fibroids which are present in the wall of the uterus. They are entirely muscular and within the wall. And if these are small in size, they will not create any problem during pregnancy. And there is a third subgroup of fibroids which are completely outside the uterus. So these are called subserosal or exophytic external fibroids. And they are absolutely harmless and they will not affect the pregnancy in any way. So basically the fact is that if any lady who has detected a fibroid for the first time during their pregnancy, they do not really need to, get panicked. And most of the times these fibroids will not create any problem. We just have to be a little cautious because yes, the risk for certain complications increases, but then there's not much to panic about.
Okay. So doctor, just tell me a little bit more deep about it. Let's say you just mentioned about the sizes. Is it something that this size is dangerous or this size, if this is fine? I mean, we need to talk about in a very layman term so that any person who is going through with the same disease can understand it more better way.
Okay, so the symptoms of fibroid or the severity, I mean, how much distress would a fibroid cause to a lady, or how much problem will a fibroid cause to a lady, will mostly depend upon two things. One is the size of the fibroid, and second is the location of the fibroid. Where is it exactly located? So, as I told you, there are three kinds of fibroids. One of the fibroids are internal fibroids. We call them submucosal fibroids. They are projecting internally into the cavity of the uterus. Okay. There is a second group of fibroids which is entirely within the wall of the uterus only. And there is a third group of fibroid which is completely projecting outside the uterus. So we will come to them one by one. So one group of fibroids which is completely projecting outside the uterus. These fibroids, even if they are bigger in size, say even if they are 7 centimeter, 8 centimeter, they will usually not cause any symptom or any problem to the lady. Okay. And if now coming to the second group of the fibroids, which are located entirely within the wall of the uterus. These fibroids, even if they are 5-6 centimeter, they can sometimes cause problems like heavy bleeding or pain during menses. So they can cause such problems. And fibroids, third type of fibroids, which are within the cavity of the uterus, they are projecting inside into the endometrium. These fibroids, sometimes even very small, say 1 to 2 centimeter, then even such small fibroids can create problems to the lady in the form of very heavy menstrual bleeding or cramps during menses. So sometimes we have to remove even such small size of fibroids also. And we can even leave a 9 to 10 centimeter fibroid as such, which is completely outside the uterus. So the symptoms and treatment will depend upon the location, which is more important rather than the size.
Understood. So when you mentioned about the, placement, and you also spoke about that we need to remove it. What time you actually get that removed? What is the time? During the pregnancy or once the baby is delivered?
No. During a pregnancy, we will not touch a fibroid, especially if it is not creating any immediate trouble to the lady. We will only do any kind of surgery during pregnancy, only if it is very, very important. And if not doing the surgery can create a problem to the mother or the baby. So mostly the fibroids would not need any kind of treatment during pregnancy. But yes, before pregnancy, especially if a lady is facing trouble in conceiving or getting pregnant because of the size or location of the fibroid, then the fibroid would require a treatment. Small size fibroids, say a lady is planning a conception, she's a newly married girl and she's trying to conceive, and she finds out on an incidental ultrasound that she has a small ultrasound in the wall of the uterus, say a 2 centimeter or a 3 centimeter fibroid. We do not want to treat such kind of fibroids, especially when they are causing no symptoms, because usually such small size of fibroids will not create any problem during the pregnancy. So we can leave them as such. And if it is a big size fibroid, and if the lady has been trying for say 1 year, she's not able to conceive, or if she has had some recurrent miscarriages or recurrent abortions, then we know that, okay, this fibroid could be a, troublemaker, and then we would like to remove that fibroid surgically. We call it a myomectomy or the removal of the fibroid.
And is it easier process or is it a big operation or something?
It is a major surgery, but it is done laparoscopically and it is an easy process, usually not associated with any kind of complications.
Understood. What exactly causes uterine fibrosis? Because a lot of people have been asking, how does it happen to me? I was good with diet and all.
That is the first question that always comes. So many scientists are still working to know the cause of the fibroids, and we till now we do not have an exact or certain cause why the fibroids develop. But these are estrogen dependent tumors, like the hormones which are made in the female body, estrogen. So they basically feed these fibroids and they lead to the formation of these fibroids. There are certain factors which play a role, and these could be genetic factors. Women whose mothers have had fibroids, they have a little more, propensity to develop fibroids. Then there is a racial factor also. Black races, women in black races, they have more incidence of developing fibroids, and it is said that around 50-60% of these women had fibroids. And then nowadays it is said that there is an increased incidence of fibroids. Many women are developing, and it is said to be due to, faulty lifestyle, bad eating habits, and, sedentary lifestyle, stress. So everything basically precipitates that estrogen dependent tumors, and they these are the, uh, hypothetical factors which basically we can say that they could be a reason for fibroids, but the exact reason is not known.
Sure. So let's suppose somebody who has already delivered a baby who had a fibroids, and now she's wants to conceive again. Again, there is a possibility that she can develop the same kind of fibroid, or let's say if she's been through the surgery and there is no chance of developing it again.
No, a lady who has already delivered with a fibroid in her uterus already, if it was there, and she has already gone through a, uneventful pregnancy and delivered, and everything has gone well, we don't need to touch the fibroid. We do not really need to treat the fibroid if it is not increasing in size, if it is not creating any problem. She can always conceive for the second time and then go ahead with her pregnancy as she went through in her first pregnancy. If the fibroid is not increasing in size, not creating any problem, we do not need to treat the fibroid. All fibroids do not need treatment. If they are not creating any problem, if they are not creating any symptom, we do not need to touch the fibroid. We can leave them as such. It is not necessary that
For
they
the
will
whole
create a
life,
problem.
I mean, is it?
Yes.
Okay, sure. And since you've just mentioned that, there are some trouble ones also, which can give a trouble. So let's suppose if the lady is already conceived. So I'm sure the pregnancy could be more tougher, like the other.
Yes.
So what all challenges she should be prepared with that, she can actually going to be facing during the pregnancy period?
Any woman who develops a pregnancy along with a uterine fibroid is at a risk factor of developing certain kind of complications, which could be in the form of an early miscarriage or abortion, preterm labor, she going into, labor or labor pains developing before her expected term. There is a possibility that there is an abnormal development of the placenta. Sometimes the placenta, that will start forming on the site of the fibroid. And in that case, there can be a lot of trouble. The placenta can separate prematurely and lead to bleeding in the second or third trimester of pregnancy. And there can be a loss of the child. Sometimes after the delivery of the child, there can be a problem in managing the bleeding of the uterus, and the lady can face a lot of heavy bleeding. We call it a postpartum hemorrhage, post-delivery heavy bleeding because of the presence of the fibroid. So as doctors, when we are, taking care of such patients who have fibroids along with their pregnancy, we have to be a little more cautious in, in looking for these kinds of symptoms and detecting early if any kind of complication is developing. And sometimes we have to be, prepared for all kind of, eventualities, like if we are expecting that there could be a heavy bleeding during delivery, so we will make arrangements for, dealing with that. We'll have the whole team around, and we'll keep our blood units available or different kind of hemostatic agents or injections available. So we have to take care of everything. The radiologist who is looking after the growth of the baby or the fetal growth, so they are also in our team, and we have to look at the growth of the baby, whether the baby is developing properly or not. So all these things have to be looked for, and mostly it is manageable. Usually complications do not develop.
Sure. Also, when women, when they are diagnosed with the same issue, do you think they need a special kind of doctor, or any gynae would be able to help them? Because they sometimes, they panic. I need an expert now. I need an expert advice. Somebody who has treated the fibroids. So do you think they need something which is not normal, or like somebody who has expertise in this? What do you think about it?
Okay, as I told you that fibroids are so common that, as I told you, that 30%, 30% of the women would be having fibroids. And they are so common that as obstetricians, as, as consultants who are dealing with pregnant patients on and off, we have seen a lot of patients who fibroids. So I think every obstetrician is an expert in dealing with such kind of cases. But yes, it is important that a delivery should be conducted at a center where all the facilities are available. And there is a team of senior consultant gynecologists that is important. So that in case of any complication or any kind of, problem developing, the team can take care of the entire process. So that is important.
Sure. I'm going to pick up some questions which I could see right now. Are fibroids possible after the reproductive age?
Okay, the most common age group who will develop fibroids would be a reproductive age group, that is 15 to 45 years of age. By far and large, new fibroids would not develop after 45 or 50 years of age. It is possible that they are diagnosed, if a lady has never got an ultrasound done after her deliveries, and one fine day she gets an ultrasound done at the age of 48 or 49 because of any other problem, we might find out that she has a fibroid. But usually this fibroid has been there since long, and usually after the reproductive age group, fibroids are unusual to develop. New fibroids are unusual to develop.
Sure. Then another question is, I am 41 years old, having 4.5 centimeter fibroid and facing heavy bleeding and continue for 11-12 days.
Okay. 4.5 centimeter fibroid and bleeding issues. Yes. For you, dear, first of all, I would recommend a medical treatment because before going for any kind of surgery, we have a lot of medical help available. So certain symptoms of fibroids can be managed with the help of medications. We don't really need to jump on the surgery at the first diagnosis or at the first appearance of symptoms. Many a times symptoms would develop at the age of 48 or 49. And at that time, we don't really need to go for surgery, and many a times medical help is available. So there are a lot of medicines available. So you can speak to your gynecologist and she'll be able to help you with that.
Because I'm sure people must be waiting that they don't want to go through with any kind of surgical treatment, and
yes,
they really
yes,
want to
yes.
go and wait for the medication to happen, which is what my question to be, that is it the surgery which is the only option, or they can also, medications which are available for them. So you've already
surgery is an
answered that.
option. Yeah. Surgery is an option only when medicines do not work, or when medicines, we know that for these symptoms, medicines will not work. So first we will come to the symptoms of the fibroids. So fibroids can have a few particular kind of symptoms. Like, as I told you, one could be in the form of menstrual difficulties. So menstrual problems can be in the form of heavy menstrual bleeding, painful bleeding, or intermenstrual bleeding. Any kind of spotting or bleeding in between two periods could be because of the internal fibroids. So second symptom of the fibroids could be pain. This pain could be during the periods, a crampy kind of pain during the periods, or it could stay even after the periods have gone. Third symptom could be compression symptoms, when the fibroids are very large and our pelvis, where the uterus is there and where the fibroids is developing, there are a lot of adjacent organs around the uterus. And if the fibroid is very large, it can compress on those organs. It can compress, if it is anterior, more towards anterior side, it can compress on the urinary bladder, the organ which holds the urine. And then it can give rise to symptoms like, very frequent urination or difficulty in urination. So such kind of symptoms can be there. Sometimes they can be, the lady, one fine day, the lady finds it that she's not able to pass urine. That could also be because of a fibroid.
Okay.
And if a fibroid is developing more posteriorly, then it can compress upon the rectum. It can lead to constipation. And so this symptom can also develop. And thirdly, if it is developing more laterally towards the sides, it can compress on the ureters. Ureters are the urine carrying pipes. So if it is compressing upon the ureters, then there can be a swelling in the kidneys, a blockage in the flow of urine, and the swelling of the kidneys also. So these symptoms can develop, and it is many a times it happens that the lady presents to us not because of any menstrual problems, but because of these compression related symptoms, and then we find out there's a large fibroid, and then it needs to be, then definitely it needs to be treated surgically. because the medicines would not dissolve the fibroid, or the medicines would not, they won't dramatically reduce the size of the fibroid. But for other symptoms like heavy bleeding or intermenstrual bleeding, we can definitely, if the fibroid is small in size, we can definitely, pass over the time, especially if the lady is in a perimenopausal age group, she's 48, 49 years old, and she's having some little issues with her menstruation. We can definitely help her with the help of medications, which will take care of the symptoms, and surgery is usually not needed for such cases.
So how long, when you say that medication could also be a possibility, how long is the process? I mean, till when they should keep on having the medication, or let's say how long they should be, they should wait, that I can avoid the surgery?
Again, a very, very pertinent question. So again, medical help, as I told, that perimenopausal ladies, or a lady who is 45, beyond 45 years of age, and we know that she's going to approach her menopause in maybe 4-5 years, 6 years,
right?
And she's having a little problem with her menstrual cycle. In such women, she might need treatment for 4-5 years or 6 years because of her fibroid. She will have to take, especially if she has severe symptoms, she'll have to take the medication, because once we stop the medication, she might redevelop her symptoms. And women who develop fibroids early in her reproductive age, say 20, 25, 30 years, especially if it is a big fibroid, and we know that such big fibroids, we might be able to control her symptoms for a little time with the help of medications. But again, she has a reproductive career ahead. She will go for a conceiving. She would like to conceive. These fibroids can create a problem in her conception, or the symptoms are very severe. So in these cases, we might need a surgery earlier. We might decide for a surgery earlier as compared to women who are very much near to their menopause, and where we do not want to do a surgery, because in any ways in another 4-5 years she would go through her menopause, and then a surgery or her symptoms would in any case.
So thereafter there is no risk of conceiving as such. What do you think?
After we do the surgery?
Yeah,
usually there's no risk. Once we remove the fibroid, she can go ahead with the conception. Usually it will not create any kind of problem.
All right, sure.
And I would also like to, yes, dear.
So the same thing, we were just continuing with it, that you were saying that medication is a process of it, but then surgeries are also required at the moment. And as early as we do, I think there are far better chances to conceive or have a better, pregnancy way or journey. Am I right?
Again, it will depend upon the location of the fibroid. If we find that this fibroid is definitely going to interfere with the pregnancy, we can remove it early. Yes.
Done.
Yes. So we have a lot of techniques. Yeah, please. Yes, please.
So any specific, any tips you would want to give it to the women who are going through with this, or let's say you think that they just got to know about it. They are in a panic situation. Any tips for them?
Yes. One question which almost comes from everyone is that once they find out that they have a fibroid, they get very panicked, and many people around them will tell them that these swellings or these tumors will turn into cancerous tumors. So they want to get rid of it as soon as possible. So everyone needs to know that fibroids are benign tumors of the uterus. A fibroid will never, any lady who has a fibroid is not at an increased risk of developing a cancer later in her life because of the presence of the fibroid. So we do not need to remove the uterus or do a surgery just because of this fact, because they feel that they're at a high risk of developing cancer because of the presence of the fibroid. It is never like that. These are benign tumors and will not create any problem later in life. So another second message which I would like to give is that many women keep on suffering in silence for a long period of time with heavy bleeding, heavy periods. They do not go for their tests. They do not go for their, investigations. They think that it is normal. It is okay to, periods to come heavy and, it removes the toxins from your body. So there are many kinds of, myths and misconceptions prevalent amongst our society. So it is very important that if any lady has a symptom of menorrhagia, heavy bleeding, or any kind of bleeding which develops between the two periods, any kind of bleeding that occurs between two menstrual periods should be definitely investigated. It could be a simple hormonal imbalance which is treatable with the help of medications, but it could be because of other reasons also, like fibroids or any kind of cancers or malignancies or anything. So a checkup is important. And many women, because of this heavy bleeding, they develop anemia, low hemoglobin levels. So women from even higher socioeconomic strata, they come to us with hemoglobin levels of 6, 7, and that's because of a heavy bleeding. So it is important they should not suffer in silence. If they have, and simple medication, simple medicine will, that will decrease the amount to more than half. So they can simply take those medications. So a checkup is important. They should definitely go for a simple investigation and checkup. And treatment is available for that. And many people have a notion again that medicines should not be taken to decrease the amount of bleeding. So it's not like that. If you're having a heavy bleeding, definitely there are simple medicines available. A simple medicine such as a painkiller or paracetamol will decrease the amount of bleeding by about 40-50%.
Wow.
So people need to know that.
It's the awareness which is required rather than, getting in a panic situation. They should actually act on it. And I think that can actually help them to have a good journey. So thank you so much, Dr. Sunena. I think it was really insightful. It was really great to have you over here. And we may have a great session again soon on a different topic.
The pleasure was all mine, and thank you for offering me this forum today to keep my words and giving me a chance to spread awareness with people. Thank you so much.
Thanks, Dr. Bansal. Thank you so much.